Hi, David, and welcome to the show. It's such a pleasure having you on our podcast, A Voice and Beyond. How's life for you in Philadelphia?
Life is great. Today, as it happens, is my firstborn daughter's 10-month birthday today, literally to the day.
Oh,
So she's
happy
going to be a year
birthday.
old in 2 months, which is bananas. That's really blowing my mind because it seemed like she was born yesterday. So she is the new love of my life. She's the cutest little baby ever, and she's crawling and she's babbling up a storm, and she's going to be walking and talking soon. So life is
Oh,
great with her, and
that's
it
so
life is
cute.
very good.
So, what's her name?
Her name is Paloma Fleur.
Paloma Fleur.
Like French for flower, fleur. Yes.
Yeah.
I'm half Latin. I'm half Latino. My dad's from Argentina, so I wanted to
Hmm.
keep the kind of Latin vibe going with the first
That's
name there. And
beautiful.
thank you. I don't know why Paloma. I just always had that name floating in my head. I just love it. It's just super like unique and pretty and artsy and cool. So
Yes, because there's a song called, isn't it Una Paloma Blanca?
Una Paloma Blanca. Yeah, right.
I don't even know who
There's
sang
that.
that,
There's
and
other ones.
yeah, I don't.
Um, I think it's I forget. It's a Mexican folk song, I think.
Okay,
I should know
okay.
that though.
You should know. Shame
I
on
should. I
you.
will. I
That
will.
the Latin half should be speaking to the other half and saying this is where it comes
Yes,
from.
yes. I need to get caught up to speed
Yeah.
there.
Now, I'm very envious that you're in Philadelphia. It's one of my favorite cities in the US. I've been there a number of times because there's a big voice conference there
Yes.
every year, and I've attended that I think three or four times.
Oh, good for you.
Yeah, it's
I
such.
have only once. You got me beat there. I
Mm,
was there in pre-pandemic,
yes.
2019, I believe it was.
Yes, but no, I fell in love with the city. And next time I'm there, I'm going to come visit you because now I can say I
Sure.
know someone in Philadelphia.
My office, when I used to go to an office that is, was literally 2 blocks away from where they had the voice symposium thing there.
Hmm.
Same block. That's on 17th Street, I believe.
Wow.
So yeah, small
Now,
world.
this is about you, and I'm making it about me right now. So, you are a clinical psychologist, you are a performance coach, a voice workshop lecturer, and you have co authored a book which is due for release in the coming months that I'm so excited for you about. And when I looked you up on the web, man, there is so much work that you do that I'm absolutely fascinated in. And I feel like a child in a candy store having you here right now. But let's do some digging first. Let's
Sure.
talk about the psychologist. So, is that what you studied out of school?
Yeah, that's my primary role out of all those hats that you just described there. This is the one, the longest and the most expensive hat, but the most enjoyable hat too.
Yes.
Uh, I have a doctorate degree in clinical psychology from the school in Philly. I've been out of school for almost 10 years now, since 2014 or so. And yeah, I am a generalist in private practice. I work with adults and teens ages 14 and up, treating a garden variety of problems: anxiety, depression, substance abuse, ADHD, work stress, school stress, marital stress. I'm also a couples therapist. You name it. When you work as a generalist, you kind of treat anyone who walks through the door for the most part. I do have some people that I specialize in, and also
Yes.
some people that I'm perhaps less equipped to handle.
Hmm.
So
And we're going to
that's my
talk,
main gig there.
yeah, and we're going to talk about some of those things that you work with because I'm so fascinated. And some of them are very relevant to creative performers and creative artists. But
Oh,
I need
absolutely.
to ask you, what inspired you to go into psychology? Because I know a lot of people do psychology because of their own kind of emotional baggage too. They're trying to figure
Sure,
themselves out.
sure. I always was interested in psychology from a young age. I think I've been blessed to be, raised by two parents who were in helping professions of their own. My mom, she's departed now, but she was a social worker. So I kind of got bit by that bug. I like
Mm,
working with people. My dad is a medical doctor
hmm.
from Argentina, very socially adept and awesome person as well. So I love people and I love to work with people. And that's the general answer. The specific answer is I was an introvert growing up in a family of extroverts. So I kind of needed to have the ability to introspect and understand why my personality was a little different compared to my family. And so I spent a lot of time kind of thinking about my family and thinking about my interactions with my family, and just kind of, in my head, whereas my family was just kind of doing their thing, and just kind of extrovertising in front of me, if you will. So I
Mm,
think when you feel a little bit different compared to people around you, it makes psychology at the forefront of your mind more often, because it becomes a lot more personally relevant kind of thing. And kind of to answer your question, like you assumed, yeah, that was challenging. I think a lot
yes.
of psychologists have, similar kind of challenges, life challenges that they needed to figure out, and therapy or psychology was a way to help them figure that out. So,
Mm. Yes, I completely understand. I have a family of big personalities, and I think
yeah.
I'm kind of like a big personality myself, but when I'm with my family, I'm the quietest one there. And
So you can relate.
and it's overwhelmed, yes, but I think when you come from a family of big personalities, you can't all be big. There has to be someone
Yes,
that is a little bit more submissive and someone that
of
sits
course.
there quietly. And it's not necessarily a bad thing. I think it's just that we're all different.
Of course. Of
Yes.
course. You
And
need someone to understand everyone. And if
yes.
you're too busy talking all the time and kind of showing off the time, then you're not going to play both of those roles. It's helpful
Mhm.
to be, the extroverted one. It's also helpful to kind of pull back and be reserved and be thoughtful and introverted at times too. So
Well, you probably listened more than what they did, and you probably learnt a lot more than what they did because you were listening.
yes, I wish I could bring you to my next family function, and you can cheerlead for everything that I went through when I was younger, and make that very
Okay.
clear to them. Yeah,
Okay,
yeah,
let's
I
do
definitely
this.
do listen.
Okay, so when's that on, and I'll be
I'll
there.
let you know. I'll let you know.
Okay, okay. All right, so let's talk about the singing side of what you do to start with.
Sure,
And
sure.
now, how did you come to work with singers, and have you sung yourself?
I have sung. Is that how you say it? Yes, I am a singer. I've been the singer of a rock band, original rock music band, that I was also the principal songwriter in. So that's probably where this push to work with singers has come from. But I've also been trained in singing too. I wouldn't say
Really?
classically trained, but yeah, when I was a kid, I was a member of boys choir in my school.
Hmm.
So I guess that would be a formal kind of version of singing training there. But I didn't take private lessons for singing. I took private lessons for other instruments, but not for singing.
Okay.
So some training, if you will. And I don't know. I gravitate towards singers because they need help, A, and B,
Yes.
well, meaning, they have a very unique kind of condition. If someone has performance anxiety and they're an instrumentalist, they can kind of hide behind the anxiety, hide behind the instrument. I mean, whereas singers, you can't hide. And
Mm.
when you're a singer with performance anxiety, you want to hide. That's
Yes.
often the behavioral manifestation of anxiety. You'd rather just not be seen in that vulnerable state like that. But there's no hiding it. You have to do it sometimes. So I think there's that reason too. I think they need help, like I said, and it's fun. It's fun working with singers. I get along well with them.
Sorry, I
Do
did
you need
have.
any more professional reasons, or is that good enough?
No, no, no. I actually didn't need too many because I'm a singer myself. And I say this with love, and me included in this statement. I always say us singers are pretty messed up. We're so much in our heads all the time. It doesn't matter whether we're suffering from performance anxiety
Right,
or not. We are always in our heads, and we're so judgmental of everything that comes out of our mouths, and sometimes even before it's come out of our mouth. So
of
that's why
course.
there was a little chuckle when you made that earlier statement. I just went, mm-hmm. Yes, we are
You
a
know what I mean.
very we are a very special breed.
Hmm. I
Mhm.
agree.
So you do work. You consider yourself a third wave therapist, and you have additional training in acceptance and commitment therapy.
Hmm.
So what is that? And so let's just start. Yes, what is that?
What is ACT in particular?
Yes, yes.
ACT is, as you rightfully point out, it's a third wave behavioral therapy, meaning the third wave is the mindfulness and acceptance wave. This follows the second wave, which was the cognitive and behavior, the cognitive wave, if you
Mm-hmm.
will, behavioral psychotherapy. But this newer wave has been popular in like the last 15 to 20 years. And it's in my opinion, smarter because it aims to teach the way you relate to your thoughts, teach you to relate differently to your thoughts, excuse me. So whereas CBT teaches you to change the content of your thinking, so it's less, distorted and more based in reality, which can take time to build up that skill to kind of restructure the way you think. You know what I mean? But ACT and similar mindfulness and acceptance-based therapies say you don't really need to change the content. You can just change the way or the context in which you experience these thoughts. That way you relate differently to them. And when you relate differently to them, you respond more flexibly to them. So ACT is
Right.
really, it's intuitive because it teaches you to put less effort into changing what you basically can't change and just learning to kind of increase your willingness to be with anxiety without struggle, without kind of trying to get rid of it, while simultaneously putting energy into things that are really valuable for you.
Mm-hmm.
For example, if you're a singer and you really value expressing yourself and value like connecting with the audience, then the idea is, can you do two things at once? Can you feel anxious on the one hand and not really struggle against that and just kind of let that be while simultaneously connecting, while simultaneously expressing? And if you have to do that while anxious, that's hard to do, right? But that is an act of flexibility. So the main goal then in ACT, specific to ACT, not shared among the other third waivers, is psychological flexibility. How flexible can you behave while feeling uncomfortable, basically?
So, okay, so what I get from that is you allow yourself to feel the feelings that you're
Mm-hmm.
feeling, but it's how you process them that changes.
It's
Am I
it's
right?
it's how you respond to them. Yeah,
How you
it's how you
respond.
respond. Mm-hmm.
Okay, okay. So, what then motivated you to use that therapy on singers? How did all that come
Sure,
about?
sure. Well, I started out with instrumentalists. The first work I did in Spain was my dissertation back in the day in 2010, 2011 or so. I worked with a pop and rock drummer in Philly, actually. And this is, believe it or not, it was not the first time that ACT had been used with music performance anxiety. There was a Swedish master's thesis that had been done in like the year prior or so. But regardless, this is a new kind of application of acceptance and commitment therapy. So I tried that out. It went well. I administered 12 sessions of ACT therapy to this pop and rock drummer. He got better. I was like, this is pretty cool. So after I graduated, I replicated that with a student violinist at a local university, kind of using everything that I'd learned in the previous project and kind of refined and tinkered as I went. That showed even better results. I got that published. I then came across the opportunity to work at a elite choir college in New Jersey. Perhaps well, maybe I shouldn't mention them. I'm not sure if they want me to mention them, but their name is in the research study.
Mm-hmm.
So I had a friend who was an alum at that school, and I think my connection to working with singers was very much because of my connection with this singer, with this friend of mine in particular. She was a graduate of this school, and
Yes.
I wanted to do another research study that was a little bit bigger than the previous two. And I was like, you know what? This seems like the gods are aligning nicely here. So let me try this out. And long story short, after months and even a year of trying to get through the front door, they eventually agreed to let me do the study at this particular choir college. So I did a small group intervention with a group of 7 singers at that particular school. And they all got 12 ACT psychotherapy sessions, plus the chance to do group performances in front of each other as part of the exposure therapy part of the therapy, which is a big component of ACT. And similar to the previous 2 studies, they got better in the same kinds of ways. So it's just been growing. This kind of research that I've been doing has started out with small scale projects and growing a little bit incrementally with every project that I do. But yeah, the most recent study that I had done was with singers, and I just was hooked, I
Yes.
guess.
And so, have you worked with a one-on-one singer as opposed to a group of singers?
Yes.
Yeah.
So in a different context, not in a research setting, but yeah,
Okay.
as a performance coach, absolutely, I've worked with pretty established pop and opera stars as a performance coach, and of course, I
Mhm.
use ACT within my performance coaching too. So
So, just I know this is very big to unpack the whole of everything that you do, but where do you start? Like, just say, I come into you, I suffer from performance anxiety, what would you do in that first session?
Good question. And there's so many ways to start. A good way, the first thing that comes to mind is building a rapport. You have to know that
Absolutely.
this person is going to
Hmm.
trust you, and having research in this vein under your belt certainly is a form of credibility. So before they've even come through the door, that helps. That to know what you're doing and know what you're talking about certainly helps. But more clinically speaking, I like to give them a Likert scale if you can. I have to use my hands here because I don't have a piece of paper.
That's right.
And I say, like, imagine the scale of 0 to 10 right here. And on this side, you have low numbers, and right here you have the middle. Over here, you have high numbers. I ask them, how willing are you to perform with your anxiety present on a scale of 0 to 10?
Mm.
And usually, more often than not, they're going to say, as you can probably guess, like a 1, a 0, 1, or 2. And
Wow,
I
that's low.
teach them that, well, it's
That's
more
low.
often the case that, yeah,
Mm.
when they're struggling with problematic or debilitating anxiety, it's usually because they have low willingness. But that's the punchline. So let me set up the joke or set up the premise first here. When you're at a low number, the way you relate to your anxiety is, this is a bad thing. It's like you're in a negative relationship with it and you want to get out of it, basically. So it's marked by avoidant behavior and distress. However, when your answer is in the middle, if you're at like a 4 or 5 out of 10, the way you relate is not the same. The way you relate to it is, it's a thing. I may not like it sometimes, but I like it other times. So it's kind of like a more balanced perspective that you hold.
Sure.
And therefore, you're not going to be as highly avoidant towards it or towards situations that trigger it. So your ability to relate and respond to it is different when you're right here in the middle. And obviously, if you're someone over here who loves anxiety, I don't know who they are, but if you view anxiety provoking situations as like exhilarating and exciting, of course they exist. There are thrill seekers out there who
Yes.
wouldn't view it as anxiety, they would view it as
Yes.
excitement, right?
Yes.
They probably don't need much of my help, but
Mm.
they're not the kinds of people that come to me for help in the first place. So it's
Yes.
usually the people that are over here that are struggling, and to be told that the way you relate actually can change. You can grow a more neutral relationship towards your anxiety, and that'll enable you to respond a little more flexibly in its presence. And I can teach you how to do that. One can learn how to do that. And that could be very healing and very helpful for someone here, that you don't have to stay stuck in this kind of bad romance, if you will, over here with your
Sure.
anxiety. You can learn to change the way you relate and therefore respond to it.
Mm. Because if someone loves singing, we'll just use singing as the example, but if someone loves singing and they could have the opportunity of having a brilliant career in that field, to suffer that performance anxiety is such a shame for
It
them,
is, of
because they're
course.
missing out on life and they're missing out on doing the very thing that they're most passionate about.
Yeah. And missing out on being really successful, even.
Mm.
Barbara Streisand comes to mind. I'm sure you know her
Yes,
story.
yes.
I use her as a case example, and hopefully she'll allow me to do this. But this
Hmm.
is all publicly available information about her. So she forgot the lyrics to a song, in front of thousands upon thousands of people in Central Park in the mid to late 60s or so. And she refused to go back. She refused to do public performances for like 20 or 30 years after that.
Yes,
And this is Barbara Streisand we're talking about. This is
yes,
someone who is
yes.
obviously a very gifted, talented person, but imagine what she could have done had she not had that experience. And well, more importantly, imagine what she would have done if she hadn't avoided going back.
I was going to say it's the avoidance, because everyone
Yes.
forgets the words at some point of time. I know in my own little performance career, and I don't compare myself to Barbara Streisand, but I can assure you. But I remember there was one specific time, because forgetting the words was always my greatest fear on
Okay.
stage. And how I handled it is, if ever I did have the thought while I was singing, oh my gosh, you're going to forget the words, while I was actually performing, that's when you'd forget them. So
Yes.
I would make them up. And I remember one night I was singing in a bar and I was singing Blue Bayou. And
Hmm.
everyone knows that song. Everyone was singing along. And I forgot the words. So I started making them up. And I was singing like, the grass is green, the sky is blue. Aren't we all having a fun time just making them up? And
There you go.
the funniest thing though, because I didn't show that I had forgotten the words and I just composed myself and I just kept poker face.
Right. No one can tell.
No
Right.
one could
Right.
tell, but no, above all that, people were singing the words with me.
Yeah. So
They
they
were
were singing the
singing the
wrong
wrong
words with
words
you.
with me. It was the funniest thing.
It doesn't matter, right?
It didn't
That
matter.
goes to show that as long as you just accept and are willing to have that experience happen to you, then the way you relate is more neutral. Then it becomes a thing rather than this dreadful, awful experience to be
Mm,
avoided, right?
yes.
And had I ever had the chance to talk with Barbara Streisand, I'm sure if I were to ask her, okay, where do you fall here on your willingness to do things to perform, in particular with anxiety presence, she probably at that age, that point would have said, it's the most awful thing. Forgetting song lyrics in Central Park when I'm in my 20s is just the worst thing ever. I never want to
Mm,
do that again. Okay.
yes.
So that is a relationship that's marked by low willingness, avoidance, and distress,
Mm,
unfortunately, for her.
yes. And so you have this 12-week program, and it seems as though you keep saying it's 12 weeks or 12 sessions, and you have a book coming out about this. So is this something that people can also use outside of being in a clinic with you?
Excellent question. I'm glad you asked me that. Yes, absolutely. And it doesn't need to be done clinically at all, really. The beauty of the ACT model is it exists in both clinical and non-clinical versions. So when used non-clinically, we call it ACT coaching or ACT training as opposed to ACT psychotherapy. And I've had the pleasure of overseeing two master's theses at the Voice Study Center, uh, piloting ACT coaching rather than ACT psychotherapy as an NPA treatment. And in both cases, these studies were done by singing teachers with
Mm-hmm.
zero education in psychology or psychotherapy, zero background in that. And with less than 10 hours training from me in ACT coaching, not ACT psychotherapy, they replicated the work that I did with those 7 students, as well as those other
Yes.
students, other musicians I work with, which has great implications for it. Now, if you're someone who doesn't have a lot of background in psychology, fret not. As long as you work with students, or if you work with coachees, if you're a coach, if you have someone's best growth potential in mind, then perhaps doing some ACT coaching would be beneficial for you to get involved here. So I'd love to talk further about when this is appropriate to do, when it isn't,
Yes.
competence, etc. But I'll just quickly share that these two particular students, they were thrilled to be able to feel helpful, to feel like, as a singing teacher, they sure could spot the signs and symptoms of performance anxiety, but prior to getting this training in ACT, they had no idea like how to intervene. They just didn't know what to do. But there's good research showing that music students don't always want to talk to a psychotherapist. They prefer to talk to their teacher because they already had that
Mm,
rapport
we
with the
do.
person. So
Yes. I call
yeah,
us frontline workers
you
a lot of
are.
the time with students. Yes.
You believe it or not, there's good psychotherapy research showing that it doesn't matter the style of therapy that you do. What's most important and most predictive of a good outcome is the relationship. So if your relationship is
Absolutely.
marked by empathy, if it's marked by a good working rapport, a good working relationship, then it doesn't really matter what the content of the therapy is, what you're doing. You're still going to be helpful. So if you're if you're a music teacher who is wondering, should I get involved and should I do this kind of work? I would say yes. If you have these kinds of qualities within your relationships with your students, that's marked by empathy and like a strong partnership, where you can agree on the kinds of problems to be solved or the problems to be worked on, then you're already helpful, because those are good, robust predictors of therapy outcomes.
Hmm.
So in those situations, yes, you might want to consider doing this kind of work. I also hinted at ethical issues too. So we talk about this often at the Voice Study Center. If you're going to be taking on this kind of work, there's some things you need to know. So first of all, do only what you're trained to do. If you've never done any kind of performance coaching within the studio before with a private student, then don't start doing it. You want to be trained. Obviously, it's like any professional development skill here, right?
Yes. Yes.
And
Absolutely.
do what's in your student's best interest too. So if you're still on the fence about whether or not to do it, and you've had some training, would it be in the student's best interest for you to kind of half, do it, or should you wait until you're a little more competent at doing this first? So You usually want to err on the side of making sure that you're competent to deliver this kind of stuff here. So quickly, to just kind of summarize here,
Sure.
when it comes to matters of competence, uh, it really just is a matter of how much training do you have in ACT. As a singing teacher or as any kind of non-clinical practitioner, you can certainly take advantage of both clinical and non-clinical training opportunities like classes, workshops, peer groups, et cetera. These all exist. And I highly recommend doing that, plus reading on the subject. And even then, if you think you're ready to start doing this work, consult with an expert, consult with a supervisor who can evaluate you for your readiness to do this kind of work, because you really need to know what the ACT model is all about. You need to know, what performance anxiety looks like, what are common symptoms of it. You need to know what kind of ACT technique would be useful based on the symptoms, based on the particular student in question here. And then when you can display to a supervisory person, an expert, that you actually know what you're talking about and you've had some experience under your belt in doing some performance coaching light work,
Yes.
then perhaps you'll be ready to do this kind of work.
Wow. So I mean, as singing teachers, we're working with human beings, and this is where sometimes, you have science versus a human, and taking on, you can look at it, you can look at as a computer screen at all the little sound waves, but that's not going to
Right,
heal everything. That's not always
right,
going
of
to
course.
fix everything. There's always so much going on with the student. And we're not therapists, and I've had this discussion with other guests. When do you believe we start crossing that boundary between a therapist and singing teacher?
Sure, it's a very good question, and you want to make sure you stay in your lane, obviously. So if you're addressing personal issues that are not related to music performance or not related to the practice of music too, then that would fall outside of your jurisdiction there. So talking about like relationship issues, talking about, significant mental health problems, substance abuse, et cetera, those don't really relate directly to the practice and performance of music, whereas performance anxiety arguably does relate to the performance and practice of music. So I see no problem in teachers getting involved in doing this kind of work, just like there are other evidence-based frameworks and training programs like mental health first aid training, like applied
Yes.
behavioral analysis. These are programs that teachers can get involved with that have come originally from psychology, but they've been crossed over into educational settings, into other non-clinical settings, because they relate to the daily work of the teacher in the classroom or the teacher in the private studios. So arguably, if it's related to performance, then yes, I think as long as you have those relationship qualities and you have the competence and the readiness as evaluated by someone who knows what they're doing, then give it a shot.
And all those trainings that you were talking about previously to do with ACT, are they things that you offer? Can people come
Yes,
to you
yes.
for all of those? Like, do you hold workshops yourself for voice teachers? Yes?
I am in the process of doing more and more of this work here because, as you can imagine, the demand is high for this here. So thus far, I've been doing trainings primarily through the Voice Study Center. I do ACT for MPA, Music Performance Anxiety courses through the Voice Study Center. I also do other ACT for performance enhancement and kind of non-MPA related stuff through the Voice Study Center too. So yes to that. Um, I'm growing this training package though, so it's still burgeoning, if you will.
Mm-hmm.
But I would like for this to be at the place where mental health first aid training is, or where applied behavioral analysis is, where it becomes like a readily accessible training package for a teacher to make use of, because it really informs what they do and it makes them more confident to handle these kinds of issues as they come up on the fly.
Yeah.
So
Uh,
that's the direction I would love for this to go in here. For it becomes commonplace for teachers to just, yeah, sure, I'm doing the music performance anxiety training. Who doesn't? You know what I mean? It's really helpful, of course.
and I think we have become so much more aware, especially since COVID, about different issues, different mental health issues that people are suffering with. I know for
Yeah,
myself as a teacher, we talk about performance anxiety more so now too, which is kind of
sure.
strange because people haven't been performing for so long. But I've noticed a change in my own students in things such as depression, anxiety. So many more students have come back to face learning where they're not the same. Students are
Sure.
far more anxious. There are a lot of students being medicated. A lot of students haven't returned to school or university. A lot of these people have been impacted, and I made the comment earlier that we are often the frontline workers. And one thing, we have talked about anxiety on the show, but can we talk a little bit about depression?
Yeah, of
Okay,
course.
so what is depression? How do we define depression as opposed to anxiety?
Depression is, well, the clinical term would be major depressive disorder, which is a mood disorder, which basically means that mood is an umbrella term that encapsulates a variety of things, not just your emotional state, and it includes your energy levels, your concentration ability, your behavior, your activities, your decision making, and all these areas therefore are affected when someone has a mood disorder, like major depressive disorder or bipolar disorder, which is kind of the opposite. So depression, commonly speaking, refers to major depressive disorder. Doesn't often refer to both bipolar disorder and depression, if that's clear. And it is it is challenging because it's a lot more impairing compared to anxiety, compared to performance anxiety. Meaning, anxiety, as bad as anxiety can get, it doesn't really like make it difficult for you to get out of bed, or doesn't make it difficult for you to go about your job and to go about school if you're still a student. So you see a lot more impairment when it comes to cases of depression than you do with anxiety. So anxiety compared to depression is more distressing in some ways, because again, to do things with anxiety present, especially in front of an audience, is really subjectively distressing. But you see more objective impairment when it comes to depression, because it's something that literally gets in people's way. Uh, Clearly, this is a problem with musicians. Musicians tend to be more sensitive than the average person. There's certainly a lot of large survey data showing that musicians have problems with depression and anxiety at like 3 or 4 times more than the average person does in Australia, in the UK, actually. So there's something to either the profession of being a musician that lends itself to depression and anxiety, or just the psychological makeup of the person who goes into the profession, or a little column A, little column B. It's hard to know, how to tease those two apart fully. But it's interesting from the ACT perspective. This is the beauty of ACT. The engine that drives the disordered version of depression is highly similar to what drives the anxiety disorder, what drives substance abuse, and what drives a lot of other problems. And that is experiential avoidance. So
Really?
if someone, to use this scale again, was on the lower side, meaning they're unwilling to do things with anxiety present, they're probably also unwilling to do things with depression present, or with urges to get higher, urges to drink alcohol present. And the engine, therefore, that drives this need to kind of like keep on drinking, or this need to avoid things that drive anxiety up, or uh, this desire to escape a low mood by sleeping, or isolating oneself, etc. It's done out of that need to kind of escape feeling, basically. And by experiential avoidance, we mean just this regular kind of cyclical pattern of behavior where someone is literally stuck in a pattern of trying to avoid feeling their feelings.
Mm.
It may not make immediate intuitive sense with regards to depression, but that is a common problem with depression. Is people tend to nap and they want to sleep away their feelings, or they tend to overeat, or they tend to
Oh.
isolate, all in an effort to avoid feeling that kind of raw emotional experience that is sadness or that is shame. So it's a very highly predictive problem when it comes to these disorders. If you're not willing to feel your feelings, unfortunately, then you're going to be stuck. You're going to be kind of furthering yourself into the trap that is depression, or furthering yourself into the trap that is anxiety too. So that's why this idea of willingness is super, super important in ACT. If you can increase your willingness, which is a decision you make, you can be
Mm.
willing to do things with sadness present, with shame present, with
Mm-hmm.
vulnerability present.
Mm.
It's no fun to have to do that, right? It requires good distress tolerance on anyone's part, but you can do that. That's a decision that you can make any day, anytime. And if you increase your willingness, then the way you relate to anxiety or depression, or urges to use substances, will be different, and you can enable flexible responding, therefore.
How
Such a key
does,
idea.
yes, the question comes to my mind here is when someone is in that state of depression, let's use depression as the example here, how do they navigate willingness?
Yeah.
Do you have to repair or help them with the depression first before they can make that decision that they are going to be willing?
That's a very good question. And from an ACT perspective, no, not necessarily. You can make progress as soon as you work on willingness, and you can work on willingness today if you want. It just takes the willingness to do that kind of work. Uh, Sadly, the cure for depression is the last thing that someone feels like doing. To have the willingness to get up and engage further in the world and to engage fully and seek pleasurable experiences. But it's so helpful. It's so healing. That's the cure for depression.
Mm.
And you know something is a disorder when the cure is out of reach, or the cure is just too hard for someone to do that. For example, panic
Oh,
attacks and panic
wow.
disorder. When someone has regular panic attacks, the cure, the way to heal it, is to be okay with having a panic attack. But that's the last thing someone with panic attacks wants to do.
Yes,
That's
because
where depression and these other disorders are
mm,
very insidious, like that.
yes, but as a society, we tend to say, "Oh, you'll be fine. Yeah, just don't worry about it." We're told to mask things. We're told, no one says to us, "Oh, that's okay. We'll feel sad." It's
Right.
the opposite. We're told the
Yeah.
opposite. And yet, like what I've learned, and I'm so grateful for this podcast because I've actually learned so much about all this stuff. And
Good. Good.
one thing that I've learned is about acknowledgement, is saying to someone, you know what, you have a right to acknowledge those feelings. It's okay to own
Mm-hmm.
them, as opposed to
Mm-hmm.
going, here, you'll be fine. Like, do something to distract yourself, keep yourself busy.
Yeah, exactly. It has like a dismissive kind of tone, like, yeah, you'll be fine. Now leave me alone, basically.
Mm.
Yeah. To go on, I'm happy to hear that this is helpful information. That's awesome. ACT is a very well researched model, so any chance I get to disseminate info about it, that's great. Um, Not only is the engine that drives the disorder the same, but the cure is very similar across disorders here. So for depression in particular,
Yes.
learning to relate to it so it's more neutral, and being like less taking it less personally, essentially. I know that sounds like a lot easier said than done, obviously,
Mm-hmm.
but there's a process with an ACT where you learn to be the space in which depression exists rather than being the depression. And you kind of just take it around with you, like you consider it kind of like
Oh,
a friend of yours that you don't really like, and you're having a party and you want to avoid inviting that one friend who's kind of smelly, and his name is, Joe the bum, and he's weird. And you know that when you have a party, he's going to show up, he's just going to like stink it up, and you don't really want him there, but willingness will enable you to still have that party. So just be willing to have the party with Joe the bum sitting in the couch, stinking up the joint, basically. And
I
and
love
depression is
that.
like that.
I
If
love
yeah,
that
if you
because
can build that
basically
willingness, then you
you
can you can
kind
still
of,
go to the party.
yeah, because you kind of, that there's a little bit of a buffer there too, because you're not making it a part of your identity. It's there,
Exactly.
but it doesn't define who you are as a person.
Exactly. Even though your
Ah,
mind will convince you, your mind will
yes.
tell you that this is
Yes.
you, that this is your fault, but that's shame. And it's good to tease shame apart from depression. You have like the pure kind of emotion of, sadness and the low mood, but then you have your mind telling you, shame on you. You're at fault here. Compare yourself to other people. They have it way better than you do. They have their life figured out, you don't, etc. That's shame. And diffusion in particular, which is an ACT skill, as well as compassion focused therapy. They have specific skills for managing shame-based thinking. And one of the tried and true methods is to not take it as personally. Just view yourself as the space in which shame exists. View yourself as the space in which shame-based self-critical thinking exists. Just view yourself as like the observer and the container of all this stuff rather than viewing yourself as it, essentially.
Yes. But that shame, that comes from society too, because we've been raised and we are surrounded by people who throw
Of course.
shame at having some sort of issue going on in terms of mental health.
Yep,
I
of
think
course.
we all have to change our outlook. Everyone needs to have more empathy, and it comes back to that
Yep,
empathy,
yep,
doesn't it? And to
it
realize
does.
it can happen to anyone. We're all vulnerable.
This is so true, and it's especially true with performance anxiety. And I'm happy to share that the second singing teacher that I supervise, her study, by the way, is about to be published in Frontiers in Psychology, literally any day now. It's due to be published soon. She worked with 6 performing arts students who had vocal performance anxiety, and she incorporated self-compassion work, and she incorporated this idea of managing shame in there. And that's really helped by coming together and bonding with people that also have anxiety, and not feeling like you need to hide that part of yourself away from your, professors or your peers. And interestingly, she got better reductions of shame in her study than I did, and I'm a clinical psychologist. She's not. We
Shame
measured
on
shame in both
you.
studies. Yeah, shame on me, exactly.
Shame on you,
I
David.
should have known better.
You
I
should
should
have
have known
known
better.
better.
But that's really powerful, though. And the remedy, therefore, for shame as it relates to performance anxiety is to find people that are like you, if you can, and use this as a way to link yourself to them rather than as a reason to hide yourself from them. And you'll soon realize that, oh, yeah, duh, that's just built into the conservatory training experience, or, the musical theater training experience. It's not my fault. And that kind of bonds you to other people, which is very healing, which like kind of undoes the harmful impact of shame there.
Yes.
So.
I'd like to move along and talk about some of these substance addictions and misuse of substance. So, what kind of addictions do you treat in your clinic?
I don't treat as much as I used to because I'm in outpatient private practice now. And I occasionally get folks with alcohol abuse problems. I occasionally get folks with, stimulants like cocaine or meth. But I've worked in a lot of different drug treatment centers. I've worked in 3 in particular. So you name it, in a drug treatment center, in particular inpatient or intensive outpatient, it's any kind of drug or alcohol problem under the sun. So I have a lot of experience in treating a variety of substance abuse disorders and clients with substance abusing disorders. Musicians in particular, they are vulnerable to that kind of problem.
Yes,
And I hate to
we're
sound like a
addictive.
broken record.
We have addictive
Yeah,
personalities.
yeah, there's that. But another way of explaining that might be due to avoidance and willingness. Because if you remember from previously, we talked about avoidance being the engine that drives disorder. Well, think of this. Let's relate this to substance abuse now. If you're not willing to have a craving to drink or a craving to get high, whenever it comes up, you're probably going to be like, "Oh man, I can't feel this way. I gotta just give me a drink right now. I got to get rid of this feeling here,"
Aha,
right?
aha.
But if
Yes.
you're willing to have it, then all of a sudden the way you relate to it is different, and therefore the way you respond to it is more flexible. You can just, I'm in the middle of a craving to get high right now. I'm the space in which the craving exists. It's not me. It's host right now. You know what I mean? And it'll pass eventually, but that takes willingness to build that kind of neutral relationship with your stuff there. So you can see there's like cross disorder and cross problem
Mm.
similarities with the
Yes.
approach here. So
Yes. Yes. Is one addiction harder to treat than another?
yes, it depends on the level of impairment, I would say. So unfortunately, you reach a point with someone that maybe abstinence or a healthier outcome like that might not be possible, and harm
Really?
reduction might instead. Yeah, harm reduction is an evidence-based treatment outcome. With some people, you just want to make sure if they want to get high, if they're a heroin IV user, for example, just make sure their needles are clean, make sure they're doing it in a safe environment, so that way they're not potentially passing out and getting hurt or something like that. So
Oh my gosh.
yeah, I would say when you reach that point with someone, it's unfortunate because you as a practitioner would want to get them off the drug, but you have to meet someone where they're at, though. They
So,
don't want to stop, or if they're not ready to stop, then what can you do about it?
what's the difference between misuse and addiction, and when does it become an addiction? Let's start with alcohol, because that's probably one that we probably can cross the line as a
Sure.
community.
So yeah, as a psychologist, obviously I have training in identifying signs and symptoms of disorder, as well as evaluating and diagnosing. For music teachers or other non-clinical professionals, I wouldn't expect one to like fully evaluate or diagnose, but you can learn how I do it, and hopefully that'll be helpful. Um, So for an alcohol abuse problem, there's a variety of ways to assess for that. There's a 4-question screener that is very well validated. It's called the CAGE, the CAGE. Each
Right.
one of those stands for a specific problem. The C stands for, have you ever wanted to cut down on your drinking? If they say yes to that, then you proceed. The A stands for, have you ever felt annoyed if someone criticizes you for your drinking or your drinking? They say yes to that, you proceed. The G stands for, have you ever had a feeling of guilt related to your drinking?
Oh my
They say
gosh.
yes to that, then you
This is
proceed.
incredible. Yes.
And then E stands for, have you ever had an eye-opening experience related to your drinking, in particular, drinking to get rid of a hangover, drinking to steady nerves due to detoxing from alcohol? So that's the E, which stands for an eye-opening experience. And again, you wouldn't be able to use this in your practice because
No,
this is for clinicians to make things
no,
clear.
no.
But it's how we screen people in or screen people out for a potential alcohol abuse problem. And the designers
Okay.
of that questionnaire recommend that if you have 2 yeses or more, then that's suggestive of an alcohol abuse problem, unfortunately.
Okay. So it's not about the number of drinks, how often they drink, or do they think about alcohol when they first wake up, or making or drinking till there's no alcohol left in the house? None of those things?
No, those are important too, and those would weigh in on the diagnosis of alcohol dependence versus abuse versus something more milder. What that is useful for is screening people in who may need further evaluation, basically. And then in the further evaluation, you would administer a more standard kind of interview to figure out, okay, do you have signs of physiological dependence? Are you craving it? Are you withdrawing when you're not using, et cetera? As well as signs of abuse, like using when you know it wouldn't be smart, driving while drinking, et cetera, using when it impairs your relationships or impairs your job, et cetera. These are signs of abuse here, using
Hmm.
more than you intended to, et cetera.
Yes. And there was a question that came to mind. What about binge drinking as opposed to addiction? Or is that a form of addiction as well?
Sure. Yeah, you can meet a lot of the criteria for substance abuse, possibly even for dependence, even if you're binging. It depends on the level of impairment. When someone is diagnosed with abuse, it has occupational or relationship or academic impairment. Or financial impairment. It really is like getting in your way, basically. So even if you're just kind of a weekend warrior, you know what I mean? It's certainly possible that the after effects of your drinking are going to bleed into your relationships. They're going to bleed into your job performance. You might not be showing up to work on Monday or Tuesday or something like that.
Hmm. Hmm.
So if that's how you mean by binging,
Yes. Or binging,
it's
I
like kind of,
suppose, is for, yeah, people may just hit the alcohol on the weekend, but Monday to Friday don't drink, but then on the weekend, absolutely smash the alcohol.
yeah, right, right.
Yeah. How do we,
So they
as
should be evaluated for a disorder. And the screening tool, again, is just a quick and easy way to screen in or screen out someone for further evaluation.
can we do
Not
that?
not to say, no, no, you can't do
So they
that,
would have,
unfortunately.
how do we then know that someone that is close to us is doesn't have a problem or does have a problem?
That's where mental health first aid training is enormously useful. And I assume you have that. I think you do have that in Australia.
Yeah,
I'm
yes, yes,
pretty
we
sure you
do.
do.
We do.
Yeah. It doesn't just include mental health disorders, it includes substance abuse disorders too. So if you get that training, then you're better equipped to handle conversations related to drinking. You're better equipped to identify signs and symptoms of substance abuse or other mental health problems. And you're more knowledgeable of like referral channels as well as self-help resources available depending on the problem. So I would err on the side of just getting trained in that because it makes you a lot more confident in your work. It makes you better able to handle these conversations and to know what to do essentially to help someone.
Mm. Yes, that's the
And you can
big
Google
one.
mental health first aid training too to
Mm.
figure out where the local training programs are for you. But
Yes,
I'm 99% sure it's in Australia
it is.
too.
It is. And I mean, in our community, a lot of people drink even before they go on stage. It's just like to calm the
Oh
nerves.
yeah.
That's a big thing.
Oh yeah.
Or hitting, and I toured in a rock band, and we always had a rider. The boys would order scotch and all these other things. And in Australia, there's a big culture around drinking.
Sure. In the US too and many other countries.
Yes.
especially in rock bands. Yeah, you're right about that.
Yes, yes. And when it comes to drug use, is there a particular drug that's more prevalent than others?
Among musicians, are you asking?
Oh, yeah, I suppose. Let's yeah, okay, let's talk about musicians then.
Well, I think more specifically depends on are they using it to control performance anxiety. If that's the case, then beta blockers is probably the go-to drug for most people there.
And
Beta
what is it?
blockers,
Yeah.
a beta blocker is it's a drug that is often prescribed for people with high blood pressure that kind of
Oh,
brings your level of arousal down. And
oh.
it's very good at treating the physiological symptoms of anxiety, like, shaky hands and whatnot. But for that reason, it's not for everybody. I'll put it that way. Beta blockers are drugs, so they prevent you from kind of moving from first gear to like second or third gear and kind of exerting more energy all of a sudden. So if you have to
Mm,
go from like piano to fortissimo in a second, a beta blocker is going to prevent you from shifting gears like that. So that you're just
mm,
stuck in like a lower kind of sedated first gear essentially. So
mm-hmm.
they're useful if you really have a shaky bow hand, for example. If you're a violinist and you really want to like stop feeling so shaky, they work in that regard, but they make you kind of like less alert and kind of dull if you take too many of them.
Is it almost like you're here, but you're thinking back here that there's
Yeah,
a
if you
separation?
take too much of them, they're a pretty mild drug. But certainly if you're taking a higher dose, then yeah, absolutely, you're going to be like not fully present with what you're doing in your
Are they
performance.
addictive?
I would think so. Yeah, I mean, they calm the nerves, and anything that works like that in the short run is
Mm.
potentially addictive, right?
And okay, and when it comes to drug misuse, do people usually start with a recreational drug such as marijuana, then build their way up to something stronger such as cocaine or whatever else? I don't know what else there is. Uh, but do they usually start with something a little less problematic?
Yeah, I do believe in that idea, the gateway drug phenomenon. It's hard to say if it's always pot though, because with some people they might start heavier. They might start with alcohol. They might start with like booze or something like that.
Hmm.
It depends on the role models in that person's life. So if you come from a family where many people drink, you come from a community or a block where many people drink, regardless of your age, you're gonna pick it up eventually. It's gonna happen.
Really? Really?
Yeah,
So is that why sometimes people say, "Oh, alcoholism is genetic"? Is it more the observing the behavior rather than it being in your genes?
it's a little of column A, a little column B, to be honest. It's hard to say addiction is just purely a biological disease. It's also a behavioral problem. It's
Mm-hmm.
also a psychological disorder. According to A or 12 step, it's a spiritual, void or like a lack of spirituality or something like that. So it depends on who you ask how it's defined. But I'm of the opinion that it's kind of all the above there.
Yes. And what are the implications of drug misuse in terms of mental and physical and emotional issues?
The implications, well, you're going to have an increased level of impairment. Certain mental health problems. We talked about depression earlier. Substance abuse is clearly one of the ones that's going to be very impairing for you, meaning like your behavior is getting in your own way. If you're drinking too much, then you're not going to be able to get up and go to class. You might potentially fail a class. You might have to repeat a class. You might not even graduate. So impairment means whether it's occupational or academic or a relationship, through your behavior, it's creating problems for you objectively that we can all collectively agree upon. When we look at your behavior over time, we see that you're not able to do the things you want to do. Whereas anxiety, I keep coming back to that because that's important.
Mm.
Anxiety is not necessarily impairing. Some people would argue it's facilitating to have anxiety, during a performance. It's like drinking a cup of coffee. You just
Yeah.
have like more energy to put into the performance there.
I'm a
So
little bit like that.
it's rare to find someone who's impaired,
Yes.
objectively, like collectively agreed that
Mm.
their anxiety and their behavior to cope with it is getting in that person's way.
I
That
call
usually
it
happens with more severe problems like
mm,
depression or substance abuse.
I call it nervous energy. Like before a performance, I always have those nerves. I'm running to the bathroom. but I like that because I feel it gives me an edge in performance. I feel like I have
Sure.
way more energy. I find all the high notes are so much easier to sing.
Okay.
You know,
Okay.
like I just find, if anything, I find having a little bit of that
Hmm.
those nerves running through me actually help a performance rather than impair my performance.
So you are in a good relationship with your anxiety then. And a good relationship with anxiety, one on this side of the spectrum as opposed to that side, is marked by lack of avoidance. It's marked by approach behavior, meaning you're drawn towards things that kind of make you feel that way. You're not going to say no to those gigs then. Because for
No.
you, it's excitement. It's not
Mm,
dreadful or anxiety. It's
mm.
excitement.
But it's also after the performance and that feeling of achievement and accomplishment, whether it's
Yeah,
a performance
right.
or even presenting at a conference or
Sure.
even interviewing someone on this podcast. I always have a little bit of, oh,
Yeah,
I want to do my best here. And then afterwards you go, oh, I actually did that. Wow,
yeah, yeah.
And yeah, I suppose that comes back to what you were talking about, feeling those feelings.
The willingness to feel those feelings.
Mm,
When you have that willingness, it's such a central part of ACT, and not just ACT, many behavioral therapies. If you can train yourself to be more willing, then you're going to be a lot more flexible when anxious. But if you're not willing, then there's like one thing you know how to do when anxious, and that's avoid. That's the only behavior you have while anxious. With
yes.
willingness comes like an addition of 2 or 3 or 4 or 5 or 6, 7 additional behavioral responses on top of that avoidance.
Mm. There's so many things that I could just keep talking to you about here.
Sure,
Just
sure.
just a couple more things. In terms of people with drug addiction, with alcohol addiction, what are the percentages of success of helping those people overcome
Mm.
their addictions? Are they one? Is there a success rate? And two, are they likely to regress at some time, have a setback?
Yes. Yes to your second question. That unfortunately, relapse is part of the change continuum. So it's very difficult for someone to recover fully from an addiction the first time. It's a skill, the skill of recovery, and like any skill building, it's just going to take you several goes at it, right, until you get it right. Unfortunately, that means the potential of like really harmful consequences. Someone who's abusing heroin or abusing really heavily alcohol, really heavily. Um, the success rate, I don't know off the top of my head. Uh, some people floated 10% when I was back in working in rehab. Some people floated less than that. I'm inclined to believe that, unfortunately, but it depends on how you define success. If you define
Mm.
success as fully recovered for a minimum of, I don't know, 6 months, then I think it would be larger than 10%, but it really depends on your measurement of success there. Just know that relapse is part of the process, and not getting better is unfortunately just part of the game. If you're working as a substance abuse counselor, you can expect that your clients are just not going to get better yet.
And
However,
yes,
however, I'll,
yes.
I'll, I'll add a little tidbit of wisdom here to bring in shame. There's a very good psychologist, Alan Marlatt. Unfortunately, he's deceased. He was a Canadian psychologist who was able to predict very accurately who would go on to have a full-blown relapse after having a small little lapse or slip up. And unfortunately, it was the people with a lot of shame. It was the people who would kind of beat themselves up for having that slip up. And therefore they get very like stuck in their head, because shame, as you talked about, is a very internal kind of, in your
Mm,
head sort of experience.
mm-hmm.
It's very difficult to learn properly when absorbed in shame-based thinking. So the addict may not realize, well, duh, of course I relapsed because I hung out with my dealer and I shouldn't hang out with my dealer. And they wouldn't have that kind of wherewithal. They would just be like, I shame on me. I can't get this right. I'm an addict. I'm always going to be messing things up, and I might as well just go have another drink or go have another drug, etc. So shame is predictive of relapse for certain types of people, unfortunately.
Yes, and it's hard to, because I'm assuming if, for example, if you have a drug addiction and you'd have to be aware of things that are contained even in prescription drugs.
Yeah.
You'd have to be careful of those. And then if you're an alcoholic, sometimes there's alcohol, like if you're eating a particular French dish that there may be red wine in that,
Right. Of course. Of
or you
course.
have a pudding that may have brandy in it. Like there's so many
Sure.
things. Then it
Or
becomes,
mouthwash with antiseptic
oh
alcohol.
my gosh,
Right.
I didn't think of that one.
Hmm.
Wow.
Yeah.
So there are so many things that then it becomes your life to be aware of all this stuff if you don't want to have a relapse.
It's hard. Let's
Mm,
face it. Getting clean from any kind of addiction, certainly alcohol addiction, is not easy to do, which makes it make more sense that you'd expect a relapse or expect at least a slip up from time to time.
mm,
And I want to highlight that it is a skill. So like any skill, as you, a music teacher, would understand when teaching technique or teaching kind of skills like that, you can expect that the person is not going to get it right the first time. And if they shame themselves for not getting it right, then unfortunately that's worse for them. That's more predictive of not getting it right.
yes, yes. Okay, well, we're going to start wrapping this up. Just have a final few questions. What
Sure.
do you think we can do better as a voice teaching community to serve our students that are suffering from whether it's anxiety, performance anxiety? What can we do to help as a community?
Sure. So the fastest thing you can do is to sign up for mental health first aid training. Absolutely. And if you're not sure if it's available within your country, then just Google it and see if it is. It's
Yep.
available in most countries. And I
Yes.
don't know if you can do it kind of like across country lines, but I see no reason why you shouldn't be able to do something like that. That'll help you target a garden variety of mental health problems, anxiety, depression, substance use, et cetera, and just know how to make referrals there. However, with the new research that I'm doing in this training package that I will be offering soon, again, I want teachers to not just make referrals, I want them to actually make interventions and do coaching work with students who have performance anxiety. So I think
Wow.
that is a highly intuitive answer to
Mm-hmm.
an age-old problem there. So
Mm-hmm.
you can check out my webpage for more information about training opportunities, to buy my book, actformusicians.com. And
Yes.
it's not quite up yet. I'm still putting the finishing touches on it for now,
Mm-hmm.
but it will be up by the summer when my book is released then. So
Yes.
for specific trainings on doing ACT with music students who have performance anxiety, you can certainly contact me. I'm able to provide that kind of training to you,
Yes.
to you or to the university that you work at.
And we're going to be sharing all your links in the show notes. So people are going,
Perfect.
anything and everything you want us to share in terms of your website, in terms of where to find your book, your workshops, where they can find you, contact you, we'll put all of that up in the show notes. No problems at
Perfect.
all. And hopefully we'll have people buying your book too, because that sounds
That would be
incredible.
nice.
Yes, yes. So I kind of think
I'm
that
too
you,
generous. I've been giving away free copies of my book for too long now. So if they want to buy it, I'm not going to stop them.
no, it's time you make money out of your knowledge. I
Sure.
think you've already answered this question, and that was what's the greatest piece of advice? The other
Hmm.
one was what can we do better? This one was what's the greatest piece of advice you would give to our voice teaching community? And if you feel you've answered that, that's fine. But if you have anything else you would like to add, feel free.
Yeah, when it comes to treating students' mental health related problems or performance anxiety, uh, get training. Absolutely. You have to have the skill set to know what you're doing here, just like any kind of profession. Obviously, any profession with continuous professional development courses available. So get training. And if you yourself are suffering, with any kind of mental health problems, then get
Mm,
help. Because let's face it, the pandemic was brutal on singing teachers, on music, on musicians at large, in the
yes,
world at large.
yes,
So if
yes,
you're suffering with any kind of mental health problems yourself, then get help too, please.
yes. And I want to reiterate here too that often, and I said this before, often we as singing teachers, we are frontline workers. As we create a safe space for for our students to be heard, and they may be using their voices in song, but as they start to free their voices, they start to
Hmm.
speak up as well. And often
Of
they'll
course.
share information with us that they may not share with anyone else. And I've actually experienced that numerous times where I've had to
Hmm.
go and report an incident or something that someone has shared with me because it was,
They were feeling
it,
so comfortable in the moment.
yes, but also too, the information that they shared was a worry. And
Of
there
course.
was there was someone was going to be harmed, someone felt that
Oh,
their life was
geez.
in danger. There's been a couple of instances that people have shared things with me that I haven't asked for them to
Hmm.
talk to me about these things. They have openly asked me or told
Mhm.
me. And when you get to that point where you feel that there's something going on that's not quite right, sometimes you have to ask another question or two to decide whether, do I report this, or
Right,
is
right.
this nothing? So there is kind of knowing that fine line between, I
Mhm.
can't ask another question here, I'm not a therapist, but
Right,
also to acknowledging that someone is sharing with you and you are in a situation that you may prevent something from happening
sure,
also. It's
sure.
a bit of a worry, actually.
Yeah, I could see that. You may not feel adequately equipped to handle the response. You may worry that you're not responding properly, or something like that. So, mental health first aid training, absolutely. I would highly
I'm
recommend
signing
doing that.
up. I
Do it.
am
Yeah,
signing up.
it's going to make you and anyone who signs up for it more confident in handling these kinds of
Yes,
conversations.
yes. Well, David, thank
Absolutely.
you so much. You've been
It was a
amazing.
pleasure. Thank you,
So much
Marissa, for inviting me.
information there, so much to unpack, and very, very interesting. And I hope that some everyone takes something away from this episode, because it's such an important topic that we've discussed when it comes to mental health issues and addictions and anxiety around performance or in life in general. So I hope
Mhm.
everyone listens to this and they learn something by it. And I want to thank you for your time. I appreciate you and look forward to hopefully speaking to you again sometime in the future. And the very best with your book.
Oh, thank you so much, Marissa. Thank you again for having me. Congratulations on your book being published. That's excellent news.
Yes, I have a
And
book too.
okay, yes, she has a book.
I have a book too. Yes, but
And perhaps one day at the next Voice Foundation symposium, we'll bump into each other soon there.
yes, and at your family gathering.
Yeah, right, right.
Yes, I can do it virtually. I can eat,
We
I
we
can
can do
have
it through
my
Zoom. Yeah,
own, yeah, I can have my
we can
own
get a
food.
we can get a mediator through Zoom. I wouldn't be
Okay.
opposed to that.
Okay.
Just know we'll pay you in food eventually. That's how
Okay.
that kind of thing works.
I'm up for that. All right. Thank you so much, Dave.
All right. Thanks
Thank
again,
you. Okay.
Marissa. Yep.
Bye.
Talk soon.
Bye.
Bye.